Imagine you wake up at 3 in the morning. The room is quiet, your family is asleep, but you can't breathe. Your chest feels like someone is squeezing it with both hands. Every time you try to pull in air, there's a high-pitched whistle, and the oxygen just won't come. You reach for your rescue inhaler, the one that's supposed to be there, but it's empty. You used the last puff 2 days ago. And the new one? You couldn't afford it? Your insurance didn't cover it. The pharmacy said come back next week. So here you are, in the dark, alone, suffocating. Not because a cure doesn't exist, but because the medicine that could save your life was simply out of reach. This is not a scene from a horror movie. This is the real daily reality for hundreds of millions of people around the world living with asthma. And today, on World Asthma Day, May 5th, 2026, we are talking about exactly this. Because if the right inhaler is not in the right hands at the right time, people die. And those deaths? They are completely 100% preventable. Before we go any further, if this is your first time on this channel, I want you to hit that subscribe button right now and tap that bell icon so you never miss a single video. We bring you real, doctor-verified health content that can genuinely save your life or the life of someone you love. And if you find this video valuable, and I promise you will, drop a comment below. Tell me what you think, share your experience with asthma, and most importantly, tell me what topic you want us to cover next. Your suggestions shape this channel, so please subscribe, hit the bell, and comment. Now let's get into this. Hello everyone, I'm Dr. Vanse, a pulmonologist and respiratory health specialist, and today I want to have a very serious, very important conversation with you. Yesterday was World Asthma Day, an annual global event organized by the Global Initiative for Asthma, also known as GINA, in collaboration with professional and patient organizations across the world to raise awareness about asthma and asthma treatment. And this year's theme is powerful and urgent. Access to anti-inflammatory inhalers for everyone with asthma, still an urgent need. I want you to hear that again. Still an urgent need, not solved, not improving fast enough, still urgent. And in the next 30 minutes, I'm going to explain to you exactly why, what's happening, what should be happening, what the science says, and what you can do about it. Let's start with the numbers, because the numbers here are staggering. Asthma is one of the most common chronic non-communicable diseases on the planet. It affects over 260 million people worldwide. And every single year, asthma is responsible for over 450,000 deaths. Most of those deaths are preventable. Let that sink in. 450,000 people a year. That's more than the entire population of many major cities. Gone. Every year. From a disease we know how to manage. From a disease we have medication for. And the reason they're dying is not because medicine failed. It's because medicine never reached them. Global Initiative for Asthma. Now let me explain what asthma actually is, because there's a lot of confusion out there, and that confusion costs lives. Asthma attacks involve obstruction of the air passages in the lungs, which reduces the ability of the person to inhale life-sustaining oxygen into the body. The airway obstruction is caused by spasm and tightening of the airway muscles, and inflammation, which causes both swelling of the walls of the air passages and mucus or phlegm blocking the airways. Think of your airways like a garden hose. Now imagine someone squeezes that hose, the walls of the hose swell up from the inside, and then mud fills the tube. That's what happens in an asthma attack. And when that happens, your lungs, your body's oxygen delivery system, starts to shut down. The brain starts to panic. The heart rate shoots up. Every muscle in your neck and chest starts working overtime just trying to pull in air. It is terrifying. It is exhausting. And in severe cases, without treatment, it is fatal. Now here's where we need to talk about the medication problem. And this is the heart of today's message. For decades, many people with asthma, And unfortunately, even some healthcare providers have relied primarily on what's called a short-acting bronchodilator, or SABA. You've probably heard of these by name: salbutamol, albuterol, terbutaline. These are the classic blue rescue inhalers, and they do work, but only in a very specific and limited way. These short-acting bronchodilator relievers only relieve the spasm and tightening of the muscles in the air passages, but inhaled corticosteroid-containing medications prevent asthma attacks by treating the underlying inflammation that causes asthma. Inhaled corticosteroids are essential for treating and controlling asthma. This is the critical distinction that millions of patients and even some doctors have historically missed. The rescue inhaler gives you relief in the moment. It opens up the airway, but it does nothing about the inflammation. It does not treat the disease, it treats the symptom. And if you are only treating the symptom, the disease keeps progressing underneath. The inflammation keeps building, the airways keep getting damaged, and eventually, a bad enough attack comes along, and the rescue inhaler isn't enough to bring you back. The gold standard treatment, what the science and the global medical community now confirms, is the inhaled corticosteroid, or ICS, or better yet, the new generation combination inhaler, a 2-in-1 device that contains both an inhaled corticosteroid and a fast-acting bronchodilator in a single inhaler. This is what GINA calls an anti-inflammatory reliever, or AIR, a combination that not only provides rapid symptom relief through fast bronchodilation, but also tackles the underlying airway inflammation and reduces the risk of asthma attacks. This is the inhaler that every person with asthma should have. This is the inhaler that saves lives. And this is the inhaler that hundreds of millions of people cannot access. Why can't they access it? Let me give you the real answer. In low and middle income countries, the lack of availability or the high cost of inhaled medicines, especially inhaled corticosteroid-containing inhalers, are major contributors to the fact that many asthma attacks and 96% of global asthma deaths occur in these countries. Even in high-income countries, high costs can mean that many people with asthma have limited access to essential inhaled medicines, resulting in poorly controlled asthma and preventable asthma deaths. Global Initiative for Asthma read that again. Even in wealthy countries, the United States, Western Europe, Australia, people are dying from asthma because they can't afford the right inhaler. We're not just talking about developing nations here. We're talking about right here at home. Parents who ration their child's medication because they can't afford a refill. Adults who skip doses because their insurance doesn't cover the combination inhaler. Elderly patients who choose between food and medicine. This is happening right now in 2026. And according to the Global Initiative for Asthma, the American Thoracic Society, and every major respiratory health organization in the world, this is not acceptable. Policymakers, governments, payers, and pharmaceutical industry manufacturers and suppliers are called upon to ensure inhaled corticosteroids are affordable and available for all those with asthma. The global call is for everyone to increase efforts to ensure access to anti-inflammatory inhalers for everyone with asthma in all countries throughout the world. Now let's talk about who is most vulnerable, because this isn't just about adults. This year's World Asthma Day theme reinforces that every person with asthma, including most preschool children with asthma, should receive inhaled corticosteroids. These inhalers reduce the person's risk of asthma attacks and reduce preventable asthma deaths. We're talking about toddlers, 3, 4, 5-year-olds who wheeze every time they run, every time they catch a cold, every time the seasons change. Children who wake up gasping in the night, children whose parents don't know the right medication exists, or can't afford it, or live in a place where the pharmacy simply doesn't stock it. These children grow up with damaged lungs, reduced lung function, missed school days, and in the worst cases, they don't grow up at all. And parents, please listen carefully to this next point because it is one of the most important things I will say today. There is a persistent, dangerous myth that inhalers are habit-forming, that if your child uses a steroid inhaler, they will become dependent on it, or it will stunt their growth, or it will harm them long-term. This is false. This is medically incorrect. Inhalers are not habit-forming. Inhaled corticosteroids used in asthma treatment are delivered in tiny doses directly to the lungs. The amounts that reach the rest of the body are minimal. The benefit, preventing dangerous, potentially fatal asthma attacks, vastly outweighs any theoretical risk. The real danger is not taking the medication. The real danger is relying only on a rescue inhaler while the underlying inflammation goes untreated. And then one day, the attack comes that the rescue inhaler can't stop. Let me also talk about something that doesn't get enough attention: asthma triggers. Understanding and managing your triggers is absolutely essential for controlling this disease. Minimizing exposure to triggers such as air pollution, dust, and mold can significantly aggravate asthma symptoms, but triggers go beyond that. Cold air, stepping outside on a freezing morning, can trigger an attack. Exercise, yes, even physical activity can set off bronchoconstriction, which is why so many asthma patients avoid being active and end up in a vicious cycle of physical deconditioning and worsening health. Fragrances, perfumes, air fresheners, cleaning products, smoke, tobacco smoke, wood smoke, wildfire smoke, respiratory infections, the flu, COVID-19, RSV, even the common cold, emotional stress, certain medications like aspirin and beta blockers. All of these can trigger or worsen asthma. And the right anti-inflammatory inhaler, used consistently, builds a buffer against all of them, reducing your baseline level of airway inflammation so that when you do encounter a trigger, your airways don't go into full crisis. Now let's address the systemic issue head-on, because I think it's important for you to understand the broader picture of why this crisis exists and what needs to change. Asthma is a manageable disease. We have known for decades how to control it. The medications exist. The science is clear. The global guidelines are in place. GINA publishes updated, evidence-based recommendations every single year. And yet, a staggering 96% of asthma-related deaths occur in low- and middle-income countries, largely due to lack of access to essential medicines. The treatment gap is enormous, and it is a failure of systems, not science. Part of the problem is diagnosis. Many asthma patients, particularly in underserved communities, are never properly diagnosed. They're told they have a chronic cough. They're told they're out of shape. They're given antibiotics for what is actually an asthma exacerbation. Without the right diagnosis, you can't get the right treatment. And without the right treatment, the anti-inflammatory inhaler, the disease spirals. Part of the problem is physician education. Not every primary care doctor is up to date on GINA guidelines. Some providers are still defaulting to old-school SABA-only treatment protocols that have since been revised. Doctors and allied healthcare professionals are called upon to ensure that all people with asthma, including most preschool children with asthma, are prescribed evidence-based, essential, inhaled corticosteroid-containing medication, in addition to or in combination with reliever medication, to prevent the continuing avoidable morbidity and mortality from asthma. Global Initiative for Asthma. And part of the problem, a massive part, is affordability and access. The pharmaceutical supply chain in many countries simply does not prioritize inhaled corticosteroids. They are not on essential medicines lists in many low-income nations. They are expensive in many middle-income nations. And in the United States, one of the wealthiest countries on earth, inhaler prices have been a national scandal for years. Americans pay some of the highest prices in the world for brand-name asthma inhalers. Generic options, while improving, are still not universally accessible, and the uninsured, the underinsured, and those in coverage gaps are left to fend for themselves. So what does this mean for you, as a patient, as a caregiver, as a parent? It means you need to be your own best advocate. Know what medication your doctor has prescribed you, or your child, and ask specifically, does this inhaler contain an inhaled corticosteroid? Is this a controller medication, or just a rescue medication? If your only prescription is a SABA, the standard blue rescue inhaler, have a conversation with your doctor about whether you should also be on a controller inhaler. According to GINA 2026 guidelines, for most patients, the preferred approach is the combination anti-inflammatory reliever, not just a standalone SABA. If cost is a barrier, ask about patient assistance programs. Ask about generic alternatives. Many pharmaceutical companies offer manufacturer discount cards. Federally qualified health centers in the United States offer sliding scale care. Don't let cost be the reason you don't have the right medication. Exhaust every option available to you, and if you need help navigating them, reach out to organizations like the Asthma and Allergy Foundation of America, which does incredible work connecting patients with resources. If you're a parent of a child with asthma, please make sure your child has a written asthma action plan, a document from your doctor that tells you exactly what to do when symptoms start, when they worsen, and when to call emergency services. Personalized asthma action plans enable individuals to better manage their condition and respond to flare-ups effectively. This simple piece of paper can be the difference between a managed episode and a trip to the emergency room. Or worse. If you live in a community with high air pollution, advocate for cleaner air policies. Asthma is not just a personal health issue, it is a public health and environmental justice issue. Disproportionately higher rates of asthma are found in communities near highways, industrial zones, and areas with poor air quality. Low-income communities and communities of color bear a disproportionate burden of this disease. That is not a coincidence. It is the result of policy decisions. And changing those decisions requires community advocacy, political engagement, and public pressure. If you are a healthcare professional watching this, and I know many of you are, I want to ask you directly, are all of your asthma patients on appropriate controller therapy? Are your pediatric asthma patients receiving inhaled corticosteroids? Are you reviewing GINA guidelines annually? Are you having conversations with your patients about affordability and access barriers? Because prescribing the right medication is only half the battle. Making sure the patient can actually obtain and consistently use it is the other half. And that requires a conversation that too many clinical encounters skip. Now let me zoom out one more time to the global picture, because this is World Asthma Day, not just American Asthma Day. Across sub-Saharan Africa, across South Asia, across Latin America, across Southeast Asia, there are millions of children who have asthma and have never held an inhaler in their hand. There are mothers who watch their children struggle to breathe and are told there is nothing available at the local clinic. There are emergency rooms in developing nations that run out of bronchodilators. There are countries where asthma is barely even tracked as a cause of death because the healthcare infrastructure to capture that data doesn't exist. The global burden of asthma is a crisis of equity. And on this World Asthma Day, the entire international respiratory medicine community, GINA, the American Thoracic Society, the Forum of International Respiratory Societies, the Asthma and Allergy Foundation of America, the International Primary Care Respiratory Group. All of them are united in one message: this must change. Everyone with asthma, regardless of their country, their income, their age, or their zip code, deserves access to the medication that can control their disease and save their life. The campaign for World Asthma Day 2026 reinforces that people with asthma need access to inhaled anti-inflammatory medicine to control their condition and treat asthma attacks. That's the ask. It's not complicated. It's not asking for a cure that doesn't exist. It's asking for a medication that is already proven, already exists, and is already manufactured at scale to simply reach the people who need it. Springer Nature. I want to close with something personal. Every week in my practice, I see patients who are struggling. I see adults who have been living with poorly controlled asthma for years because they were never put on the right medication. I see teenagers who are embarrassed to use their inhaler in public and skip doses as a result. I see elderly patients who have developed permanent lung damage, what we call airway remodeling, because decades of undertreated inflammation have fundamentally changed the structure of their lungs. These are outcomes we could have prevented. These are lives that could have been fuller, healthier, longer. And that's why I make these videos. Because information is medicine. Because knowing what to ask your doctor, knowing what your treatment should look like, knowing your rights as a patient, that knowledge can change the trajectory of your health. Asthma does not have to define you. It does not have to limit you. With the right diagnosis, the right medication, especially the right anti-inflammatory inhaler, and the right action plan, people with asthma live full, active, unrestricted lives. They run marathons, they climb mountains, they perform on stage, compete in sports, raise families, and thrive. The tools are there. We just need to make sure they reach everyone who needs them. So on this World Asthma Day, May 5th, 2026, I am asking you to do 3 things. First, if you or someone you love has asthma, please review your treatment plan with your doctor and make sure it includes an anti-inflammatory inhaler, not just a rescue inhaler. Second, share this video. Someone in your network may have asthma and not know that better treatment options exist. Your share could genuinely save a life. And third, subscribe to this channel and hit the bell notification button, because this is what we do here. We bring you the latest, the most accurate, the most clinically relevant health content, explained in plain English, so that you can make better decisions for yourself and your family. And before I go, I want to hear from you. Drop a comment below. Tell me, do you or someone in your family have asthma? What has your experience been with accessing medication? What questions do you have that I haven't answered today? And tell me, what topic do you want me to cover in my next video? Is it COPD? Is it allergies and their link to asthma? Is it childhood respiratory health? Is it lung cancer awareness? Is it sleep apnea? You tell me. This channel belongs to this community, and I will keep showing up every week with the information you deserve. This is Dr. Vance. Thank you for being here. Breathe easy, and I'll see you in the next one.